discharge and 11 days after discharge. So they're coming back pretty quickly. 34% come back within the first 4 days of being discharged. And so these are the folks that are frequent flyers, and we have a lot of initiatives going on with our contract with NAVA Health and otherwise to try to reduce this readmission rate. High-risk medications is another area. There are a number of drugs. I think all the physicians are getting pretty familiar with the Beers criteria. We have really taken these high-risk medications off the formulary for the most part. Effective 1/1/14 is just a way of trying to get our older members off these high-risk medications. Some of them are frequently used drugs that have been used for years, and so I know we're going to get some pushback from some of the patients and from some of the physicians about taking these drugs off the formulary. But it's well published now in the literature about the problems associated with these drugs, and we're really trying to get them off or away from our elders just to improve their overall health. Some of the high volume drugs that we see, the tricyclic antidepressants, amitriptyline and other tricyclics, hydroxyzine, the long-acting sulfonylureas like glyburide, some of the muscle relaxants, cyclobenzaprine is used a lot, methocarbamol is used a lot in this population, and then long-term use of nitrofurantoin. So these are some of the high-risk medications that are no longer covered, and I know for Carl, we've tried to put alerts in the EMR so that when physicians go into the computerized physician order entry system and they enter these drugs into the order entry system, they get a pop-up of a formulary alternative to try to move our patients to drugs that are viewed as a little bit safer for them to be on, and that's what this list is all about. So some of the strategies that we use to try to boost ratings, I've talked a little bit about the EPIC alerts. We're sending out reminder letters. We put out a publication that most of you have seen called Infomed. Obviously, Dawn and her team are doing a lot of work around coding. We're really, as I was saying before the meeting tonight when we were sitting out having hors d'oeuvres, I said this is really a time in the history of medicine where the payers and the providers have really got to collaborate. There's so much regulatory environment that's impacting the caregivers and impacting the payers, that this is really a time where we've really got to put aside whatever our differences may have been in the past and really try to work together to try to make sure that our communities are able to get the revenue that they need in the community to frankly take care of the members who live in these communities. And that's really what this is all about at the end of the day. That's really why I'm in the business, at least. And we're just going to have to work closely together on all